Andy Johnson. We are looking at adolescent mental health. 3 major causes of death for adolescents, in adolescence, and suicide is the 3rd leading cause of death. This is one of many reasons why we must address this as educators in middle school and high school, especially because adolescence is when the onset of most mental health issues, mental illness, occur. Now, adolescence is naturally a time of extreme turbulence. Lots of things to sort out. The brain is still developing. We've got all this new sexual equipment that we're dying to take for a test drive. It's a major part of your life when you start doing some major things. However, extreme passion and mood swings are normal for this time, so it's often hard for teachers as well as mental health professionals to figure out what is normal and what isn't. And it's hard for students to know what is and isn't normal. Adolescents do not have a good sense of normal because they're only inside their head. They're not inside the head of others. This is one of the reasons why it's important for students to read good books of students their age going through similar situations. Now, the most common, and to have small group discussions as well, and to talk about mental health issues. This is important for teachers and parents to talk about these things. The most common mental health disorders: anxiety disorder, depression, and eating disorders. And I'm doing this to address the misperceptions related to mental health and some of the lack of knowledge or misinformation related to mental health issues. I've dealt with these in my life. There's a picture of me in the 70s, and we're going to be talking about this. And I'm putting this in the context of my experience, not to talk about me, but to help people understand. The goal of this video lecture series is to bring understanding to this very important issue to help improve the quality of lives. Now, one of the ways in which we can address mental health issues, and it's not our job as teachers to cure, but we can create the conditions that are more healthy. Now, I think it's important to have structured small group discussions where students are able to talk about life situations, etc. And that's a great way to spend 5 to 10 minutes of any class period, is to create these structured conversations. We need to address the interpersonal skills and the intra, going within elements, emotional, understanding your own emotions. Teach social skills explicitly. This is what you do when you ask for a date. This is how you be a good friend, these sorts of things. And as I've said, we have to talk about mental health issues so we know, so students know. This is anxiety. This is depression. All right? This is whatever. This is an eating disorder. As well, it is so important to read good young adult literature, narrative texts about students going through similar situations. And again, remember, the adolescent is only inside his or her own head, doesn't know what normal is. So reading good books is one way to get inside the head and to understand other students, other adolescents going through similar situations. End part 1.